This is a very sensitive issue. And I think that we just lack the language, or we lack the comfort in discussing it. I think people are aware of it, they're just scared to talk about it. And sometimes it's because when people do talk about it, they get bad press, or people get very angry, or they get hate mail. But I don't mind those things, because I feel like we need to talk about it. And it's through talking about it and getting people comfortable with it, and finding the appropriate language and the sensitivity of talking about it, that we'll be able to continue being able to talk about it, versus if we avoid the topic, it will never be discussed, and people won't feel comfortable, discussing it or using it. I mean, it's a two-way street. You have the providers who may recognize it, even if they do feel like it's complaining. But what will happen is once they start approaching the subject, the patient will react pretty negatively. And because of that, then the provider will avoid talking about it anymore, provide giving education. And so it's kind of like the providers trying to ease the discomfort of the patient, but by doing that, they're actually perpetuating the problem. And so again, I think it's important to talk about it. I'm not really necessarily married in calling it a specific thing, because I think the word catastrophizing comes with a lot of stigma. But it could be called magnifying. I'm fine with using it in that terms, but I think what's important is to understand the concept, understand how to assess people to determine if they are engaging in that kind of behavior, and then getting them to the treatments that are shown to be effective in addressing the problem. The most obvious would be cognitive behavioral therapy, and that's when we look at maladaptive thinking and maladaptive behaviors that change the perception of pain. And so that makes the most sense. And one of the things that we do in cognitive behavioral therapy is cognitive restructuring, where we find people get into these mind traps, and one of them being catastrophic thinking, and show them ways in which they can change their thinking, which will then change their perception of pain. So they're both kind of in the negative spectrum, or the negative schema, what we call it, of pain, right? So you have fear, you have fear anxiety, you have depression, you have neuroticism, you have catastrophizing. All these things are generally poking at the same area, but they mean different things, right?